Hi everyone, welcome back. So this is the last one that I'm doing on the Gains Without Pains series of videos. As you'll know if you've seen my other videos in this series, I talk about how, sports therapy is, also about educating my clients in terms of posture, in terms of exercise technique, and what they can do to prevent injury in the future. So I am looking at common exercises done in the gym, and looking at sort of where people make those mistakes that lead to injury, and also how you can improve your technique. So today I am going to be talking about clean and jerk deadlifts. So the clean and jerk actually has, I suppose, two main sort of stages. So you've got the clean movement, which is basically where you are lifting the barbell from the floor into a front racked position, a squatted position, sort of up to towards a standing. The jerk movement is where you powerfully move the barbell from the front rack position to an overhead position, with the elbows in a locked out position, in one smooth sort of power movement. So firstly, I'm going to talk about the benefits of a clean and jerk. Some of these will be similar to if you've seen the video on the Romanian deadlift. So obviously, it's a metabolic movement. It's great because it involves pretty much every muscle. It will work certainly those hamstrings. Which when so many of the other gym exercises, your squats, your lunges, your leg press, they all work in the quad muscles. So, these deadlifts are a good way to kind of balance out, because we know the quads and hamstrings are kind of in balance with each other. So if one becomes weaker, that can be a common cause of injury. But also the clean and jerk is great for sort of increased athletic power, increased strength, and certainly of the legs, but also of the upper body and the core. The clean and jerk, benefits of the clean and jerk as opposed to maybe say the Romanian deadlift, is that it involves a deadlift, a squat, and a press all in one movement. So you're really getting a sort of good workout in the one exercise. So common mistakes that people make when doing this exercise, inconsistent setup. Just, if you start out with a poor, starting position, the likelihood is that this is going to lead to, mistakes in that first pull, and consequently increase the risk of injury. If you are yanking on the bar, so early arm pulling, if you just have a lack of sort of spatial awareness off the floor, that it's just going to, again, it's going to encourage mistakes throughout the clean movement. People may do this just through fatigue, or maybe because the weight is too heavy for them. Another mistake, is not staying over the bar. So once the bar passes the knee, and you're transitioning into the second pull, if you don't stay over the barbell, what this means is that the hips will probably move forward prematurely, and the arms will bend, and you'll fail. There'll be a failure to finish the pull. Poor front rack mobility is another mistake, and this will often result in basically poor mobility of the thoracic, so that's sort of mid upper back region, shoulders, triceps, and the elbows. All of those will then be at risk of injury. Limited thoracic mobility and also stability. If you have a tendency to sort of collapse through that thoracic part of the spine under the weight, then, again, the weight is probably too heavy for you, but you should probably focus more time on just general training on this area before you look at doing like a clean and jerk, because those muscles, you really need some stability there to be able to perform that jerk movement. So okay, so in terms of good technique, I'm going to sort of talk through each step of the clean and jerk exercise, and sort of what you should be doing to to reduce the risk of injury, and to just try and ensure that each part of your body is in the right position for sort of optimum mobility throughout the exercise. So the first stage is the setup. Now, we've said that one of the common mistakes is actually that people maybe don't get their starting position right. So, it's important to really take time to get that correct. So feet should be about hip width apart, slightly turned out to enable you to keep the knees and the thighs out. The shoulders should cover the barbell with the hips lower than shoulder level, but higher than the knees, and keep the bar close to the shins. Standard, lifting. So then we go into the first pull. Now, so this part is when the barbell breaks from the floor to when it passes the knee. So at this point, you need to stay balanced in the full foot, keeping the shoulders above the barbell, lift with the legs and the back, and the angle of the spine should remain fairly constant throughout this phase. Taking us into the second pull, which is where the barbell passes the knee and approaches the middle thigh to the hips. So again, you need to stay balanced in the full foot with the shoulders above the bar. Push through the foot for as long as you can, and finish as upright as possible in order to increase the height at which the barbell can be turned over. Because again, this will reduce the strain on the back. Then we go into the third pull, which is basically where you have the forceful rotation of the elbows underneath the barbell and into the front rack position. Okay, so that's basically when we're going to move into this position. So we're going to use the trapezius muscle, which is that one sort of at the top of the back. to elevate the bar higher and basically then pull, so you're going from that sort of position to pull yourself under the bar. And you're going to reposition your feet firmly in place so that you can get into that squat position. Now, this then takes you on to the receiving position, which is where you are settling in that squatted position with the barbell racked on the front of the shoulders. And at this stage, you're just going to maintain a front squat position with the hips low, chest high, and elbows up. That will then take you into the jerk movement. So first off, we have the jerk dip, which is the downward loading movement of the jerk. So you're dropping into a quarter squat. You're keeping your weight back in the heels so that you don't put extra strain on those knees or ankles. And you're going to maintain a rigid upright torso and elbows. And this will help you avoid falling forwards or losing balance in the dip. You're going to bend the knees and hips slightly to load the legs. Now, this will take you into the jerk drive, where you basically drive the weight off the body. So you're going to use those upper body muscles to stabilize the torso rather than press the weight. And you're going to forcefully use these leg muscles to stand up at the succession of the dip. And then finally, this will take you into the sort of receiving the jerk overhead, which is where you move your feet into a proper finishing position depending on the type of jerk. So the weight now is completely overhead, and your leg position, as I say, depending on the type of jerk, it could be a split, power, push, or squat jerk. And that is basically your clean and jerk. So as with the Romanian deadlift, there's a lot of focus on, the legs sort of driving the movement, but still some use of those, core muscles, rather than actually using the back muscles to lift. So yeah, that is basically it. As I've said in all of these videos, I am not a personal trainer, so the information here is based on my anatomy and physiology knowledge as a sports therapist and what I see in practice. So if you are starting out at the gym or you're starting back after injury, do consult with a personal trainer just to make sure that you are doing the exercises safely, and they may even be able to give you some tips that I've not given you today. Do keep an eye out. I will have more sports related videos coming up, talking about specific muscle groups and specific muscle injuries, and how you can reduce the risk of those and how you can treat them, should you get them. So subscribe to my channel and you'll be notified when they come out. Feel free to contact me through my Facebook or Instagram with any questions. And but for now, that is it from me. So exercise safely, and I will see you next time. Bye.